One of the questions I sometimes ask my patients is, would you like whiter and brighter teeth? And most of the time, everybody says yes. It is possible that we can help you do that. It's a good thing to be a dentist at this point in our world. We have at our hands a lot of different options to help make your smile whiter and brighter. Aesthetic dentistry simply is things that we can do to make your smile better. If you probably think of whitening or bleaching, we talked about veneers before. Even the white fillings that we use nowadays, the composites, are so much better. A lot of folks had these fillings done 30 years ago and they were more porous and they picked up a lot of stain during those 30 years. Nowadays we have brighter colors, whiter colors, and we can take out those old fillings, replace them, and make things blend a little bit better than having some dark spots between your teeth. We don't put amalgam fillings or silver fillings in here. So the good news is if you're going to get a filling, it's going to be the same color as your tooth. We also don't do a lot of metal or gold crowns. There's specific times when we might do that, but I'd say 95+% of the crowns that we put in people's mouths are all porcelain. So things look a lot more natural with those, without anybody being able to notice that it's a crown at all. That's probably been a quest of dentistry ever since that I can remember. They were always coming out with new crowns, new types of crowns, new types of porcelain that would allow us to do what we needed to do to improve the smile. So not only do we talk about whitening, we talk about crowns, or as we also talked about veneers, combinations of all three of those to get that desired white smile and brighter smile. So there's a lot of things that we can do. We're getting into an area of dentistry called orthodontics. And for years, when people thought of orthodontics, they thought of brackets and wires. And that still exists, and the orthodontists do a great job. But what we've seen in the last 20 years are clear aligners that we've been able to use to straighten the teeth and focus on the anterior part of your mouth, the front part of your mouth. By rotating teeth and lining them up properly, even a tooth that's not as white will always appear whiter because the teeth are straighter. And in some instances, we can do a lot by going in and adjusting the teeth a little bit. If we go down to the lower, is very commonly some crowded teeth, we can go in and trim off some of them, straighten them up just a little bit without even doing aligners, and make a big, huge change in the way things look for the patient. But the nicest thing about aligners is it gives us a tool that the patient can go and use without having the brackets and the braces like everybody that goes to the orthodontist typically has.